doing operation is eradicating the diseases away from the body.
Not in all cases.
Okay.
Not in all cases. Because this disease we are talking about, don't forget, is a cell. It's even better when we are talking about tumor. There are two categories. We have what we call benign tumor. Benign tumors are tumors that will not kill, but can be there for a long time. Ameloblastoma, somebody can carry ameloblastoma for 25 years. The jaw will be broke, it will be big, grotesque, but the person will not die.
The rains are here and they come with a lot of complications, especially weak and vulnerable segments of the population. Medical experts says this is the likelihood of increase in cases of common cold and malaria and other diseases associated with poor hygiene. This is the conversation where we dive into the most pressing issues of our time, exploring the ideas and perspective that shapes our world. Welcome. I am Beatrice, okinbaloye. Let's get this conversation started. Today on the program, we will be discussing managing common illness associated with the rainy season. And with me here on the conversation is Dr. Saidu Bello, a dentist and an implantologist. He is the CEO of QH Specialist Dental Clinic and Research Center. He's also the founder and executive director of CLEFT FACIAL Deformity Foundation, free surgery for facial deformity since 14 years. It's good to have you here, Dr. Saidu. Thanks for coming.
Yeah. Hello, viewers. It's nice being here, talking to Nigerians again.
With the situation right now, with the rainy season that we are, what are the health challenges that people will definitely be facing in this rainy period?
Thank you very much. What is very important is that we definitely know that, especially in this part of the world, we have dry season and wet season. So generally, we just have to be on the guard. We know already that during this rainy season, there is cold, what we call upper respiratory tract infection, which is catarrh and the rest, is definitely not out of place. So we just have to take a general precaution.
Okay, so see, this some of these health complications are mostly caused by people, and maybe due to their carelessness or not monitoring their health. In cases like so, how can we avoid some of them in this season presently?
Thank you very much. That question is actually very wide. If you are asking generally about prevention of diseases, yes, that is a very wide topic. Generally, in medicine or medical science, we actually talk about primary prevention, secondary prevention, tertiary prevention, and this applies to all diseases, not just being specific now. Primary prevention of diseases means that everything you do to minimize chance of diseases from occurring. So, and is a wide range, starting from nutrition. Generally, if you have good food, it means that you are going to have good immunity. If you have good immunity, it means that general diseases, even the upper respiratory tract infection we are talking about, and so many other diseases, the chance is reduced. That is nutrition. Then we talk about hygiene, generally. Taking care of everything about us, about our body, taking a bath, then ensuring our food before we eat, ensuring the foods are washed properly. You understand? Whatever general hygiene, even where you sleep, where you pass, your environment could not be too stuffy, So generally, so when you do all this, then another aspect of primary prevention is regular checkup. Many of us, what we are interested in just using the body. We've forgotten that a body is like a car that is being used regularly. Definitely, at a point, a checkup becomes necessary. You want to check how you are. A lot of people don't even know that they are hypertensive, and they are going about still shouting and still believing everything is well. Sometimes somebody will just come to even in our dental clinics, somebody just comes to clinic and we suspect we need to check the blood pressure. You just discover that somebody's blood pressure will be 190 over 120, and this person is still shouting. I once had a patient that said, "I'm on, please, the doctor, can we be fast? I'm going to the airport. I'm going to the airport." I said, "Okay, please, you check the PP of this patient." It was 210 over 140.
Wow.
That patient should be on admission. So these things, if we are able to do regular checkups, then a number of other diseases could be detected before they go far. Regular check. Many people don't even know they are diabetes. So regular checkups will show that, okay, your sugar is going high. We'll be able to say your lipids profile is going high, your cholesterol is going high. All these things could be arrested before they begin to do damages. So that's generally when we talk about primary prevention. But when we talk of secondary prevention is when something happens. How do you arrest it? That is secondary prevention. You discover that now you are already hypertensive. So what else could be done to make sure that it doesn't cause damages? Because hypertension is not a problem on its own. It's the damages that it will cause. Diabetes, in absolute terms, somebody has sugar, that's not the real problem. But the real problem is complications that will arise from them. So we discover that some of these things, once you've identified them, but by and large, what is important is that many of us want to believe we are poor, we don't have money, we not solve basic problems. But you discover that to do a regular checkup is not really so expensive. Because if you go to general hospital, I don't know if a registration could be up to 1,500, 1,000 in general hospital. And you see doctor. Doctor sees you and they just do basic tests. Check your BP alone, check your sugar alone, might not cost more than 1,000 naira. And that will put you in a good stead regarding good health. So, but generally we have poor culture of checking up. If we are well, we just believe that we are well and we are well forever, and there can't be any issue. Everything we put at the doorstep of God will do it.
So the secondary prevention that you are talking about, is there a permanent cure to some diseases? Because you said that the secondary prevention is when you started addressing the diseases, a particular illness that you found on yourself. So is it a permanent cure, just for temporary or just for maintenance?
You see, we are just talking in general terms.
Yeah.
Okay, let me use for instance, I'm first of all a dentist. Many people also use their mouth. They are not bothered about what if anything will happen. So some people have the habit of coming regularly every 6 months for checkup. If in the course of checkup, if we discover anything in the mouth, we address it. So going to the hospital regularly is primary. You are not having anything. You're not having any issue. You are just going there. You want to avoid, and they will teach you properly about proper hygiene, how to take care of your mouth, how to take care of your teeth and everything. So you avoid getting disease. But if somebody comes to the clinic and we discover that there are holes in the person's teeth, definitely the issue of we want to carry out filling. Like you talk about it, some of them could be permanent. Could be permanent in the sense that, for instance, if you are able to arrest, if your caries is hole in the tooth, if you are able to fill a particular tooth, you might be surprised. Some people might tell you, this filling was done 20 years ago, and nothing will happen to it forever. But please don't quote me. It's not as if we cannot have issues if somebody has filling, because there are many issues we can't start discussing now. People have some people listening to me now and say, yes, but I had feeling 2 years ago. They are having a pain again. There are so many issues that we can't start discussing now. But what I'm just saying is that, based on your question, it's possible. Now, they have to be cautious in answering that your question, because when people listen to professionals, they want to take everything that whatever you say, yes, is from the oracle. That is true. It doesn't, in many cases, it doesn't really guarantee. Cure. Take for instance, if you discover you are hypertensive, you are going to, when you are hypertensive, you've gotten a license to see doctor till you die.
Oh, so you are just on maintenance base.
Is manageable. It's not hypertension hardly disappears, except in what they call secondary hypertension, in which the cause is due to a particular. But if you are that, if it's cause is due to particular ailment, if it's due to kidney disease, now they manage that kidney, you are fine. The hypertension might be maintained, but or things like peripubeta, usually when women they want to deliver, when during pregnancy, when they deliver, the hypertension goes down. But if you are that, you need a regular checkup to be sure that you are still safe. Sometimes you are on regular drugs, you are diagnosed diabetes. It doesn't go. But these cases are manageable, and it is that management that all of us should be concerned about. But asking at the end of is curable. Some cases are possible, but in many cases are not.
Okay, so getting a permanent cure in health is not a fully guarantee, but there's always a maintenance stage and a temporary cure. Right?
Absolutely. Okay. Even a doctor is happy that he has checked on you and you are fine, isn't it?
Yes.
Even the doctor too is happy that, oh, madam, you are fine. But it's good enough that you have seen the doctor and doctor says you are fine, rather than assuming. Because that's the problem with us. Because that is why I'm being careful answering your question. What our people want to hear is that I've got a permanent cure. That's the end. I won't go to the hospital again. It's not guaranteed anywhere.
Okay.
You see, the body, the replica of a body, what I can see is a car. If the car was actually made from a prototype of a human being, the way the car runs, that's why different parts of the body also keeps on working. You see, like now, if I say you are 35 years now, it means that since you are born, your heart has been working continuously for 35 years. Yes. It means that all your organs, they've all been working, your eyes, your mouth, your nose, they've all been working continuously for 35 years. So, is it possible for you to have a car and it's running continuously and you won't do servicing?
Yes.
It's not possible.
Okay.
So that's why the culture of checkup should be encouraged. And they have just said it to our people. If you want to be serious about it, it's not really, it doesn't have to be expensive. Agreed, the big man checkup could be fine, but it doesn't have to be too expensive if you are really interested in just seeing your optimum. Yes, you can go to general hospital. There are many general hospitals. As I said, I'm sure registration is between 500 1,000, and the doctor checks on you and checks your parameters. They are fine, and he said, okay, let's do the basic. Let's just check your sugar. You discover that those ones are not really much.
Okay.
Yes, if they are now reason to suspect other things, that okay, oh, madam, we need to see your lipid profile, we want to see, is a different thing. But to know the basic things is not really expensive.
Okay, that's impressive. So, what do you think about a danger to self-medication? Because some people thought that they can handle things their own way. Like if they just feel a slight headache, they it's feeling like I'm having malaria very soon. Or just in this season, this rainy season, that and cold catarrh is everywhere. So any small thing, they feel slightly ill, they'll be like, oh, it might be malaria. Let me just go and buy malaria drug, over the counter. So what's danger to self-medication? So how dangerous self-medication can be to someone's health?
Luckily, you are talking to a village man. So I want to take it from two perspectives. Generally, in fact, just yesterday, my cleaner just came. I've gone to do test, and I have typhoid and malaria. I said, I look at her. I say, you like this, you have typhoid and malaria? This is what our people do. The next thing she wanted is I should get her drug for typhoid and malaria. If she had the money if she had that money, she won't come to me. The next thing is that she heads to the pharmacy and tell them I have typhoid and malaria. And they also load all the drugs and load for her. So I don't know. Our people, we just have to look. We just have to. Our orientation, we just have to think about our orientation. It's as simple as that. Because sometimes poverty is an issue, there's no doubt about it.
Yeah.
But ignorance is another, if not a bigger issue for me. Like what I've just told you now. This young lady has gone to lab, has already done test, probably about 5,000. From there, she will move to chemist. The chemist will load all these things for her. At the end of the day, she has already spent 10,000. Now, what happens? If this same lady had gone to general hospital and sees a doctor in general hospital, 500, 1,000, you've seen a doctor, consultation. In the first instance, you see, a doctor is trained to know there are a lot of issues. That's what we call empirical management. Do you know that if you come to me and I discover that you have everything, you have symptoms of malaria. Are you following?
Yes, sir.
Do you know that I can start treating you for malaria even without doing any test? Yes, we call it empirical management, and it cut across so many parts of medicine. Now, sometimes because in some cases it cannot wait. You cannot even wait for that test. We have cases that the tests are impossible. Let me give you an example. Let me go to dentistry again. When you have hole in your tooth, after some time, if care is not taken, the hole continues to get deeper. By the time it gets deeper, the next thing is that it enters the bone. Then you begin to have, you can't sleep again, you have swelling. Are you following?
Yes, sir.
That is called dental alveolar abscess. It's caused by bacteria. Are you following?
Yes, sir.
As a dentist, I've been trained to know which organisms are responsible.
Oh, so without the person going to
I can't even have, there's nothing to test. There's even nothing to test. There's nothing to test because even the pus come from there will not be obvious. You can't even see any pus to take to lab. And even if you take to lab, it takes 3 days. So for somebody that didn't sleep yesterday, you want to wait for another. So we call it empirical management. So we continue to manage. So a doctor will do a large number of cases will have been attended to without even talking about for somebody that has little money. And he has seen, as I said, he has seen a doctor with 500 now. Doctor discovered that what you have described matches malaria. And he gives you malaria pills and you spend like maybe let's say 4,000 to 5,000 to get the drugs. You are well. You are spending lesser than 10,000 of my little girl that first of all, it was not referred by anybody. The first thing he went to lab first. So self-medication, that is one aspect. Self-medication again has a lot of disadvantages. But why I said earlier that you are talking to a boy from the village is that realistically, Nigeria is very, very far from universal coverage, from universal health coverage. Are you following? If I take you down now, okay, although many of you now are Abuja or Lagos girls, if I ask you now, you tell me your local government, that your local government, you might not have been there, so you don't know what we are talking about. But for people that grow up from the villages, you discover that there are complete 3 local governments in Nigeria that cannot be boast of one doctor, if we copper none. Are you following? Now, if you say there shouldn't be self-medication, what exactly are you saying? I don't know if you understand what I'm saying. The health coverage of Nigeria is very, very poor. So many local governments that cannot boast of a single doctor. So that people have to travel several kilometers. So, yes, government to government have been trying about primary health care. Primary health care is something that we need to strengthen. So even at that, we still have the issue of manpower. We still have the issue of manpower. The nurses are going abroad, doctors going abroad. So that one is actually not a big problem again, because, sorry, it's a big problem, but we can't just be complaining. There are many auxiliaries that have been trained to actually work at the primary healthcare level, which that has to be encouraged. When we are talking about this primary healthcare, it's even worse with a dental treatment, because you can conveniently gather 10 local governments in so many states. Dentists are only found in the cities. You hardly see dentists outside state capitals in most parts of Nigeria. I'm from Oyo State. Specifically, I'm from Okeogun. The whole of the 10 local government that constitute Okeogun in Oyo State has just 2 dental clinics. And the 2 dental clinics, the dentists are found mostly in the state capital. They are found in state capital. It means that they probably come for they live in state capital in Ibadan. So they probably go there on Tuesday, and by Thursday they are going back to the cities. And it has to do with the number. That's why when somebody is hammering so much on brain drain, there's nothing anybody can do about brain drain. The only thing that could be done, because in recent time I realized the government is encouraging production. We can only do everything to strengthen our institutions. Are you with me?
Yes.
By strengthening our institutions to produce more. I don't think there's any country that has brain drain that's more than India.
No.
But when you go to India, you also find out that there's virtually, I don't know if any country can compete with India in production of doctors. I want to be specific now, because the state of Kerala in India has 28 dental schools. School of Dentistry has 28, out of which government is about 3 or 5, and the rest are private. Nigeria put together has about 18 dental schools. The whole of Nigeria has about School of Dentistry 18. And the state in India, state of Kerala, with capital at Kochi, has about 28 School of Dentistry. If you go to UK, if you go to America, the population of Indian doctors is amazing. You don't need anybody to tell you. There's actually no hospitals you enter in UK, America, that you want to believe that sometimes you want. I attended a conference in America. I was literally feeling like it is India. I mean, the population of Indian doctors that came for that conference. So you can't do anything about brain drain as long as there's a gradient. What I mean by gradient is that the level, we are not at the same level. And naturally is the law of nature. There will always be movement from higher to there will always be movement. Like in practical terms, to lower poverty to higher standard of living. People will definitely want to migrate, either looking for more money, looking for better environment, things like that. So if you are from third world, there will always be, if your child is playing football now and I ask, Kano Pillars or Liverpool, which one will you prefer for your son to play for? The answer, Liverpool. Why? Because you know that there's a better life with Liverpool. It's the same reason why you can't stop nurses, doctors, anybody, any professional that feels that his or her service will pay more somewhere. Is definitely there's always the impetus to go. But the only thing we can do is what the land government is trying to do. At least I'm sure of nursing. More and more schools are being licensed and regulatory authorities are also there. If government can do more of this, school of medicine, school of dentistry, we establish more, we keep them more and produce qualitative manpower. That's the only way we can reduce. So by and large, the summary is that we started from self-medication. Self-medication, yes. We have to encourage our people. It's not the best. Take advantage of whatever is available. But what do we do about local areas where people don't have a choice? People can just be dying, and you say they should do nothing. That's the reality. So we can only talk to government. Is our big father. We can always tell them that primary health care has to be strengthened. Because if there is access, self-medication will reduce. That's the point I'm trying to make.
All right, we'll come back to that. Let's go on a short break, and we'll be back. We'll talk more on health. Thank you. Welcome back. This is the conversation. We have been speaking about the various health sectors and diseases and how we can take care of ourselves. And today we have here with me Dr. Saidu Bello, who has been telling us so much about health issues and how well we can prevent this. So, Dr. Saidu Bello, I know that you are a dental practitioner. So I just want to ask, as a dental care practitioner, what are the common illnesses that you face in your field, in your area of specialization?
Thank you very much. I think the greatest challenge with dental health is the fact that people believe the mouth is just meant to be used only. And no form of maintenance is necessary. I think that's the biggest problem. We use, like I said earlier, the body is like a car. So when the mouth is also being used, you break bone, do this, maintenance is necessary. So a regular checkup, like we started earlier with primary prevention, is actually the best thing. Generally in dentistry, we advise that people do checkup twice a year. During this twice a year, they will do regular cleaning of their mouth. But in addition to that, they will have the opportunity of dentists checking through their oral health and advise. If something is going wrong, they will advise you. If the disease that is setting in, they will advise you. And once they advise you that a disease is setting, then you'll be able to take secondary prevention, that you don't allow it to progress further. So talking about the commonest diseases, the two commonest diseases in dental clinics are actually dental caries and gum disease.
Can you break it down in normal language?
Yes. Dental caries means hole in the tooth. Okay. A hole. Sometimes you open the mouth of a child, a growing child, and you see black spots on the teeth. And later they will begin to see that there's actually a hole, a cavity. So that is what we call dental caries. Dental caries actually has to do with Normally, our mouth, all of us have what we call resident bacteria. Bacteria that God has just created there. They are our friends. They are just in the mouth. Don't worry about. Don't worry. Don't be afraid that I'm saying your mouth has bacteria. Everybody's mouth has bacteria. So these bacteria, we call them their resident flora. They are part of our normal body. So when you now have these sweet sticky things, that's why we talk about sweet. We talk about chocolate. When you have these sticky, sweet and sticky things act on the surface of the teeth, the bacteria and the sugar will form acid. It is that acid that gradually destroys the surface of the tooth.
Okay.
Now, as it continues to destroy the tooth, it goes gradually, it goes very, very gradually. Over the next 2-3 years, it may just be there. You won't feel anything. Now, when it gets inside, when it's getting a little deeper, the inner part of the tooth is sensitive. So you begin to feel some sensitivity. Then later, when it gets more deeper, you find out that it gets to where the nerves are. Then you start feeling pain. Incidentally and unfortunately, it is only when people cannot sleep again that they believe they have problems. Assuming people will be able to come to clinic, that is where what I was telling the other time, why it's difficult to say, I've done this, that's the end, that's the permanent. Because it depends on what level. If you are just having sensitivity, and we discover that it's a small hole, you go to dental clinic, they feel it for you. That might be the end forever. If the feeling doesn't come out, you don't have any issue. But by the time the thing continues to enter inside, then you cannot sleep again. It has gone beyond let us just feel and come back. Other things will become necessary. Are we together? So this dental caries is the commonest problem, and it can now give rise to pain. We call it pulpitis. It will give rise to pain. Somebody will not be able to sleep. Then, of course, unfortunately, that is the time many people believe that we have problem.
And those kind of illness, since you talk about, is mostly when sugar things come. So it happens a lot with some children and growing up kids. Right?
Yes, that is actually that is correct.
Because it's children that do like sugar things.
I totally agree with you. But just a quick one. Early childhood, that's what we call early childhood caries. In children, 3 things are important. When we are breastfeeding, it's important that we don't leave breast overnight. We don't leave children sucking overnight. Because when that is done, it keeps breast in the mouth of the patient for a long time, constant. That will stimulate bacteria.
Okay, so
and cause.
I say your food that comes out from the breast is also sugary.
Of course. Of course.
Okay.
It's like basic biology. Lactate is sugar. It's sugar molecules. So okay. It's also broken. So when we have to breastfeed and a child sleeps, that's fine. But by the time your mother will sleep off and the breast is then you keep in the mouth of patient, it causes early childhood caries. That's number 1. Number 2, second level, when you have to be using feeding bottle. You are using feeding bottle and children sleep with feeding bottle. You keep it in the mouth. It means that interface of bacteria and sugar is allowed to take place over a long time. It allows for acid production. Is that clear? Because somebody may want to ask, okay, what about if I drink Coke? If you just drink Coke and you wash your mouth, that's the end now. That one, there will be no chance, there's no time to allow for formation. But you just throw something in your mouth and you just finish and go. That's not what we are talking about. But sticky things that will stay in the mouth for a relatively long time. So the third thing, as I said, I was tracing from breastfeeding, feeding bottle. Then the third one is when children are now growing, sweet. So you are absolutely correct to say more in children and growing children. We want to make them happy, you know. It may not be mommy, it might be father, it may not be father, it may be uncle. That because there are many people that don't regularly have time to give their children sweet, but that the uncles are there to give them. I have one patient last 2 weeks ago that the father agreed that he wasn't the one, that but their uncle was their friend, and that's the friend of a child. So basically, that is how caries, which is a hole in the tooth, come about. So, but what is important? Regular checkup is advised, and when this is when you are feeling these early signs, I'm having sensitivity, I'm having small hole, little rice will enter, but I'm still sleeping. That's the best time to go to clinic, not when you are not sleeping again. Okay. Then the second commonest is gum disease. This gum disease, as you may want to say, that will be commoner in the older people, yes, because the teeth have been there for a long time and there has not been care.
Yes.
That's why you find that it's more commoner in males than females, because generally females want to take care more than but generally in the older people is when we have gum disease. And gum disease is nothing other than just total neglect of our mouth. You see, as a child is growing, the culture of check-up twice a year is helpful, because if you have to do check twice a year, you do cleaning. If this is actually maintained, somebody will just grow normally, and gum disease is something that is unlikely. But many of us, many people have not, in fact, many people that are 40 years, 45 years, they have never been to dental clinic, not even once. If you are there, but I brush now, you brush, but the brushing you do, no matter how much you clean, something still remain behind, which could only be handled in the dental clinic.
So it's also death that causes gum diseases.
It's also
death.
Not even also. That is nothing more. Okay. Maybe academic discussion, there may be little something. Sometimes systemic disease also contribute. For example, people that are diabetic patients, it may interest you that diabetes also shows in the mouth.
Oh, wow.
Yes. If somebody is diabetic, the chance of gum disease and whole pockets in the gum, food will be getting lodged, it becomes higher.
Okay.
So there are some few conditions like that can also help. But essentially, the major is death, local death. Local death on the teeth is what causes gum disease. Irritation and it's very it's so interesting that primary prevention costs very little. For instance, primary prevention is regular checkup. That you don't have any issue. You just you don't want it to happen. You go there, they guide you how much. If you like, don't go to private clinic. Go to general hospital, dental clinic. I'm sure. I doubt if you spend 5,000 on cleaning. I don't know. Things are changing anyway. Don't let me. I'm sorry. Things are changing. Maybe 5,000 to 10,000. You do that, but you do that for another 6 months. So once that is done, and the hygienist will guide you. It may interest you. There's something that is common. Your brushing technique, there's a particular way to brush your teeth. This is a short program. Maybe subsequently you can bring a hygienist to the program to talk more on that. If you are fond of handling your brush like this with force, many of them come to clinic. We find out that many part of the teeth are worn off. We call it cervical abrasion. You just discover that, and this is the force of. So just simple lecturing you and guiding you will make you to stop that, and you brush normally, and you won't have such conditions. So prevention is something very good generally.
Okay, that's a good information you've given us right there. So as a surgeon and a researcher, especially when you're performing some some operation surgical cases.
Yeah.
Those diseases that you perform operations on, because most times when we go to the hospital and it informed us, okay, the next thing that we can do is to perform an operation on it. So we do believe that, okay, after the operation, maybe that's after, you know, maintenance, after the operation and taking the aftercare, maybe it's give us a permanent cure. So is it a permanent cure when, so some of those surgical operations that you have performed, is it permanent cure to those diseases or just for maintenance use?
No.
Or, I know you said it the other time that there's no guarantee for a permanent cure. But the way we understand a surgical aspect, like for example, they say you have a tumor in one place, when it is being removed and you go to some a chemotherapy or you go through some aftercare, before you know, you'll be fine. Maybe in a few months you'll be fine, and you know you won't see that disease again. You're okay. So we always see operation as the last stages of our health. You get so, and some people try to avoid it, and in case you couldn't avoid it, eventually you come into conclusion that you have to be operated on. So we believe that after the operation we are good and we are back to our normal health, maybe after care. So is there really a permanent cure? Because I'm sure my viewers, we definitely want to know that is those operations permanent? Because I know you are an experienced surgeon.
Thank you very much. Yes, I'm a maxillofacial surgeon, which means surgeon of the face and the bone of the face and the rest. These are questions that we have to address many times. And yes.
So
first of all,
to do acts.
Oh, that's on daily basis.
Yeah.
You see, first of all, you know, there are myriads of problems, and all these problems are also specific in their entities that are different. In fact, if I'll be talking for 10 hours, I won't be able to exhaust. But one thing I can tell you generally, to answer you, to give you a general you see, surgery is a last option for anybody. I don't know why people get this impression that surgeons just don't want to, they just want to operate. It's not.
But you said it's the last option. So means it's the last option to your freedom. Yes.
In most cases, yes, is the last option to your freedom. But that freedom depends on the nature of what we are talking about. Okay, let me give some few scenario.
Yeah, from that's what
I want to take. That's what about 2 weeks ago. In fact, not even 2 weeks ago, it's a week, because the patient is still on admission now. I just operated on him about 3 days ago, when he had an accident, and this bone, you know, this cheekbone, got broken. And of course, this place is depressed. You know, a young man of 30 will not be happy. So now we did the operation in which we lifted this bone up and fixed it. That man's problem is the end forever. That bone that was broken and fixed back is done. Once this patient, who is still on admission now, is out of admission, and that bone has been fixed, that is all. It has been fixed.
That is no freedom.
That is his freedom. It doesn't have any other thing. So we have cases like that. It has been fixed. Somebody has the bone of the and you fix it. For instance, somebody just had, immediately after the accident, this young man could not eat. His mouth is bent like this. Now we fix the bone and the patients are eating. That is the end. We have fixed the problem. He's eating. There's nothing to go back to. But why the issue of we cannot say permanent or will I come to the hospital is that there could be complication of an operation
after surgery. It's
a possibility. Even if you take a doctor to court, you won't win, because it's a normal possibility.
Okay.
If there is complication, for instance, there's infection after operation. So, if there is infection, we treat the infection, but that does not mean that you will not come back again. Abi? that is one thing. This plate, this one I said, the jaw that is broken, and you fix it. We fix them with what we call implant. The implant doesn't do anything, doesn't disturb anything, but somebody come back later and tell you that he doesn't want the implant in his body. You go and remove it. So the person still comes back to the hospital. So you understand? So it's possible in some cases. It's actually your way to freedom. The surgery is meant to be way to your freedom. That is in the context of solving problem. Yes, it's targeted. This is just like you said. But why in a number of cases you cannot just say it's the end of issue is that we have cases. Take for instance, one of the commonest tumor of this jaw is ameloblastoma. We have seen cases that was done 20 years ago, and somebody is coming down now saying and he or she has realized another swelling. There's one little girl I operated 2 years ago, just very little girl of 9, and we discovered he had ameloblastoma of this maxilla. Of course, when we do operation, we send for test and confirms. Just 2 weeks ago, I just saw the guy in my clinic that the thing started growing again. It's not because I didn't know how to do it. It's not because I didn't do it well. It is the nature of the disease itself. It can grow back. It has been documented. It's not the first. It's not the second. There have been several.
Right. So it's like doing operation is eradicating the diseases away from the body.
Not in all cases.
Okay.
Not in all cases. Because this disease we are talking about, don't forget, is a cell. It's a cell in the body that becomes mitotic. It becomes that changes nature. One cell changes nature. And after changes nature becomes uncontrollable. Now, it's not in all cases. It's even better when we are talking about tumor. There are two categories. We have what we call benign tumor. Benign tumors are tumors that will not kill, but can be there for a long time. Ameloblastoma, somebody can carry ameloblastoma for 25 years. The jaw will be broken, will be big, grotesque, but the person will not die. But it's different from cancer. Any cancer of the body, like breast cancer, the cancer will kill anybody within maximum 2 years. Will kill the disease, and it grows fast. So the same thing, we say breast lump. Breast lump in many cases are benign. That's why they can remove the breast, and somebody will say, I removed breast 10 years ago. Yes, it's alive. And everything is fine. And might be the end of it. It has happened. It doesn't have to recur. If you have a fibroadenoma of the breast and you remove it, it may not recur. But it's not impossible. And it's the same thing in the whole body. Abnormal growths are the same all over the body. I can affect the eye, the nose, the brain, the pancreas, the stomach, the nail, the leg, every part of the body, it could be affected. If we have abnormal growth inside the eye. So what simply happens is that the growth are generally divided into benign and malignant. For benign ones, in many cases, you can remove them and they will not grow back. You can remove some and they will still grow back. It's not the surgeon's fault. It's documented. So we just have to, in most cases, those that I know can come back. For instance, cyst, there could be a swelling and it's due to a ball, like a ball on the face. It's a cyst. When you do it, in most cases, it's very unlikely. It will not come back. But then you have something like ranula, cyst within the tongue. That one has the chance of coming back. We know it. So you can't.
The hole in the teeth, sometimes it comes back.
The hole in the tooth. What is interesting about that one is that it comes back. Why that one? The chance of it. In fact, what comes back? Many people hardly come to clinic when it's just a hole. That's why I said when the hole is at the level of what we call dentin, which is just the second layer, this outer layer is the enamel. The next layer is dentin. If it's just within that, early, you clean it, do the filling. That is all. Nothing can come back. But in many cases, it will have been gotten deeper. When it gets deeper, nobody can arrest it. It's already getting to the third layer. Nobody can arrest it. That's why somebody will say, I did filling 6 months ago. Now I'm still having pain. You're having pain because the thing has gone too deep.
Oh, well, that guy still come back. You are just trying to make us understand that it's not most surgical cases that turns to a permanent cure. Just like you said, it's not all illness that turns to a comical, but there's always a maintenance for everything.
Yes. In many instances,
everything.
maintenance could be necessary. But the surgical cases like we are placed are straightforward. It's either it recurs or it doesn't recur. If it doesn't recur, you don't really have any maintenance. That's the truth. For instance, you remove if you remove a breast lump and you don't have anything, you don't have to say, you don't need any maintenance, because if you come to us as surgeon, we won't do anything. Sometimes we may say come for checkup, but it's not as if you have ameloblastoma. If I remove tumor from here now, and the person, how many people even remember? When they are well, nobody likes a doctor if he's well. There's don't deceive us. We only remember doctor when they are not well. Just like why will I remember my mechanic if my car is functioning well? It's not peculiar. It's a general thing. If my car is functioning, why will I remember a mechanic for what? That is exactly like that. But for primary prevention, checkups are important for human body, and even for oral health, checkups in dental clinic is also important. And for general body, checkups important. Check your BP, check your blood glucose.
Yeah,
basically.
like you're talking about the body system. The body system determines how well your body will be treated fine. Like sometimes let me just cite these examples. You might, two of us might be feeling the same diseases.
Yeah.
And we went to the doctor at the same time. We get treated at the same time. I was feeling fine on time. Maybe within a short period, I was already okay. And you keep recurring, you keep visiting the doctor. And it was, we are both administered the same drug, and it was the same diseases we went to complain about.
You said the same diseases. That is where there is a difference.
No, like maybe like the doctor saw us, and we are told we both had the same illness. We might be two different separate people.
Exactly.
And this is, for example, we both had the same illness, and we are treated at the same time. But I got all right. I was feeling better. Within some few period, I was fine. But yours keep occurring and keep occurring. So that's how I'm coming towards the body system. That is it. Okay, the aspect of the body. Maybe my own body system is faster and yours doesn't is faster. Is it like we have different bodies? I know we have different body system, but the lungs you have is the lungs I have. The heart that is always the so I thought. So why is some people has delay in treatment? You hear that it's not the same.
Why some people even die, some people die alive.
But and the same, they are being administered the same thing, being properly taken care of equally, and you'll be like, what happened? Or even the aspect of that surgery, we both go for the surgery. Some have a permanent cure, and some doesn't just have the permanent cure. You be like, why?
No, you see, the basic thing is that the basic reality is that, first of all, the fact that two of you have fever does not mean that both of you have malaria.
Okay.
You might have fever. Your own might be due to upper respiratory tract infection. Somebody will have fever and will discover that he has malaria. Somebody will have fever, so will discover that the patient has a pyelonephritis of the kidney and he's also having fever. Somebody has fever, you discover that it's hepatitis he has. Somebody has fever, you discover that it's typhoid fever he has, not so that's number one aspect. So the fact that two people go to the hospital with the same complaint does not mean that we have the same disease. That's number one. Then coming to treatment too. Yes, you know, like we said earlier, even in medicine, common things occur more commonly. Are you following? Somebody, you just get to the hospital now, you have fever, and the chance, because in this our environment, the first thing that comes to the doctor is that you have malaria. Before they now look at other things and now say, no, this is not malaria. This one is, there are other reasons why you are other things. But somebody cannot just sit up in front of a doctor like that and say, you have fever. You are likely to have meningitis. I mean, of the brain. It's not. That's not the commonest thing. So the doctor will not start from that level now.
Okay.
So that is one. But about treatment, about the issue of the body too, there are a lot of factors that affect the system. You and I do not have the same genetic composition. We do not have the same genetic composition. And your body system is regulated by a lot of factors. Gene is one of them. Look at this cancer we are talking about. A number of cancers have been found to have predisposition within family. For instance, now if you have breast cancer, they will always tell you that if your mother has a breast cancer, children has to be on guard.
Okay.
You understand? Because there's a higher chance. If mommy or daddy died of diabetic complication, you as an offspring should know that you have some predisposition to diabetes. You understand? So the body system, the same way, even your immune system, the way you respond to disease can also not be the same. You put it the other time, you have malaria.
Exactly.
Your immune system, my immune system cannot be the same. Even though our type of immune is the same, but they are not regulated they are regulated by different genes. So my own, you can't expect my own to be exactly like your own. And that's why the progress too cannot be the same.
Okay.
How you are going to respond, whether you are going to be cured, whether one's going to die, we cannot predict it precisely.
Oh, thank you very much. So the body system really have a great impact in improvement of our health.
Definitely.
Wow, that's amazing. We have a great time today. Thank you very much for coming. And this is where we draw the curtain and our conversation for today. I would love to thank our guest. Thank you so much, Dr. Saidu Bello, for your knowledge and your insights. And to our viewers, thank you for watching the conversation. And until next time, keep conversing, keep exploring. I'm Beatrice Okinbaloye. Goodbye.
Goodbye.